Welcome back, everyone, to the Psych Files podcast, where you, the listeners, submit your most pressing psychological questions and we, the experts, answer them. Our most recent submission is a rather personal one from Jane, who was shocked to learn of her dad's recent Alzheimer's diagnosis. Jane says she thought this disease only affected senior individuals and her dad is only 50. She would like to learn what this disease is and what her dad is likely to experience in the coming years.
Well, Jane, we are really sorry to hear about your dad's recent diagnosis. This is a very prevalent disease, being the most common form of dementia in the population and the leading disease burden for Australians aged 80 years and older. As your dad is under 65, his diagnosis would be classed as early onset, which is a less common diagnosis, but not at all unheard of. Many of you have experience with this disease in your own lives and be very familiar with the profound effect it has on an individual's memory.
Yes, difficulties with memory is certainly the most distinctive symptom. This is because Alzheimer's disease is neurodegenerative, meaning it is characterized by the death of brain cells, also known as neurons. This death starts in a brain region called the medial temporal lobe, specifically the entorhinal cortex, and then spreads to the hippocampus, both of which are extremely important for memory function and the formation of new memories. This is why, at first, individuals with this disease may be confused and forget recent events. They may ask the same question twice or easily get lost. As this disease progresses and more brain cells die, the symptoms will worsen.
That's right. More severe symptoms might include language impairments, such as struggling to find the right words, and hindered sensory processing. For example, impairment of hearing and sense of smell. They may be unable to learn new things, and as memory problems and neuronal death become more severe, they have trouble recognizing their own friends and family, which understandably can inflict a great emotional toll not only on the individual with the disease, but their surrounding support network too.
Yes, it is a devastating disease, and at its most advanced stage, a patient's brain will have shrunken significantly and undergone dramatic brain cell loss. This causes individuals to be unable to communicate and need full-time care, and eventually they will pass away.
Despite much research, it is still unclear in the academic community as to why some people develop Alzheimer's and some don't. Although we have found a leading theory on the biology of the disease, this involves the buildup of specific proteins called amyloid and tau in the brain, which become toxic for neurons and leads to widespread brain cell death.
Yes, quite right. Although we don't know the exact cause, we do know there are also associated risk factors. These include older age, genetics, epigenetics, brain injury, poor diet, obesity, diabetes, and vascular diseases.
Yeah, it seems nutrition, exercise, and regular brain exercise are the best way to reduce the risk.
Interestingly, individuals with Down syndrome are at significant risk as their extra chromosome carries the APP gene, which dictates the production of the amyloid protein previously mentioned. Around 50% of individuals with Down syndrome will develop Alzheimer's in their 50s to 60s.
This provides some of the main evidence for the amyloid cascade hypothesis as a leading theory on the cause of Alzheimer's. However, there is some controversy surrounding this theory, as brain scans have detected amyloid plaque burden in patients who show no signs of memory impairment. Additionally, trials that involved anti-amyloid drugs showed no significant improvement in Alzheimer's patients.
Yes, this theory does hold great weight. However, I am partial to the inflammation hypothesis. This theory reasons that chronic inflammation in the brain, caused by an overactive immune system, contributes to the death of neurons. This immune system uses cells called microglial, and in the early stages of Alzheimer's, when the individual is asymptomatic, these cells act as a protective factor and clear out protein waste. However, it has also been suggested that in the later stages of the disease, when individuals are symptomatic, these microglial actually worsen disease progression. Certain genes, like APOE4, may act as risk factors as they are associated with an increased inflammatory response.
That's right. Recent studies have found promising results using anti-inflammatory drugs to delay or even reduce Alzheimer's cognitive decline. However, some are controversial, and overall, the results are inconclusive.
Now let's take a look back through history to the cholinergic hypothesis. This theory was among the first proposed to explain the development of Alzheimer's. It suggests that the production of acetylcholine, a neurotransmitter involved in memory and learning, is reduced due to the deterioration of the brain cells responsible for its production, called cholinergic neurons, as Alzheimer's disease progresses. It proposes that restoring the cholinergic system may improve Alzheimer's-related cognitive decline.
These theories are fundamental for Alzheimer's research, as they insinuate related treatment avenues to explore so we can reduce the burden of this distressing disease for both the individual, their families, and our healthcare system. So, let's start with the current treatments for Alzheimer's, shall we?
Sure. Currently, our primary treatments focus on managing symptoms and slowing down cognitive decline. One of the main classes of drugs we use are cholinesterase inhibitors, such as donepezil, galantamine, and rivastigmine. These medications work by increasing the levels of acetylcholine in the brain, which can help improve memory and cognitive function.
That's right. We know that memantine is another important treatment. This medication is an NMDA receptor antagonist, used for patients with moderate to severe Alzheimer's disease. The NMDA receptor is a key part of the brain involved in memory and learning, and overactivation of this receptor can cause damage to brain cells. This drug works by regulating the receptor's activity, protecting the brain, and helping to manage symptoms. It can be used alone or with cholinesterase inhibitors to manage symptoms more effectively.
I've also heard some exciting things about sleep as an intervention for Alzheimer's. Is it that easy?
Well, yes and no. In terms of an intervention for Alzheimer's disease, slow wave sleep specifically may reduce an individual's risk and may slow disease progression. However, Alzheimer's disease primarily affects older individuals. This can present a challenge as slow wave sleep typically declines as we age. This means we need interventions to increase slow wave sleep for individuals at risk, such as the elderly. This can include emerging techniques like acoustic stimulation, which has been shown to promote slow wave sleep.
That's really interesting. Are there any emerging treatments that we should be aware of?
Yeah, there are several promising treatments in the pipeline. For instance, donanemab and ALZ-801 are in advanced clinical trials. These therapies reduce amyloid plaque buildup, which is key in the pathology of Alzheimer's. These drugs work by binding to proteins, which allows the immune system to become aware of them and thus target them for removal.
Yes, by clearing these proteins, disease progression can be slowed, especially in the early stages.
Exactly right. We call these drugs second generation immunotherapies. Another one targeting amyloid is remternetug, which is similar to donanemab, but with potential for better efficacy and fewer side effects. It's currently in phase 3 trials, which is the final and largest stage of clinical testing before a new drug or treatment can be approved for public use. However, these treatments may be less effective for patients with more tau buildup as they only reduce the amyloid protein.
Although the antibody boontane tap may target tau.
Oh, yes, this lab designed protein is being explored for its potential benefits in Alzheimer's as well, by providing a second generation immunotherapy for tau tangle reduction.
Alternatively, semaglutide is a synthetic hormone that has also raised interest. Traditionally, the drug has been used for the treatment of type 2 diabetes. It mimics a naturally occurring hormone which helps regulate blood sugar levels, but it may also have neuroprotective effects. The drug may reduce inflammation in the brain and thus promote brain cell survival according to the inflammation hypothesis for Alzheimer's.
Although these drugs are not widely available yet, they hold potential for more effective treatment options in the future that have the possibility to significantly reduce the progression of the disease.
Yes, it is very exciting. With slowed progression, patients would be able to preserve their independence for longer, as their cognitive state would be much less declined. This would also benefit their support networks, as they don't need to provide intensive care day to day. It would reduce the emotional toll inflicted on friends and family, as they are able to be with the individual and their memories for longer. Overall, it would greatly improve quality of life for both the individual with Alzheimer's and their support network.
And besides the available treatments, what can we actually do to reduce our risk?
That's a great question. One of the most effective strategies is lifestyle modification. For instance, following a Mediterranean diet can significantly lower the risk of Alzheimer's. This diet includes lots of fruits, vegetables, whole grains, olive oil, and moderate fish intake. It's all about eating healthy and balanced meals.
Oh, of course, that's a given. But diet isn't the only factor, right?
Absolutely not. Regular physical activity is another key component. Exercise not only improves overall health, but also boosts cognitive function and reduces the risk of dementia. Activities like walking, swimming, or even dancing can make a big difference. And let's not forget about staying socially and mentally active. Engaging in activities like reading, playing games, or even learning new skills can help build cognitive reserve, which is like a buffer against cognitive decline.
Exactly. Social engagement is crucial. Spending time with friends and family, participating in community activities, and staying connected can all contribute to better brain health.
Yes. Oh, and I recently heard about precision medicine approaches. I want to briefly explain what it is. Precision medicine tailors prevention and treatment plans to an individual's specific risk factors and genetic profile. This involves deep phenotyping, which means detailed characterization of a person's traits, where the individual is the sole unit of observation. It's all about personalized care.
Oh, wow, that's really interesting.
It is. I think combining these strategies seems like the best approach. For example, the finger study showed that a multi domain intervention, including diet, exercise, cognitive training, and vascular risk reduction, significantly improved cognitive function in at risk elderly individuals. By addressing multiple risk factors simultaneously, we can develop a more comprehensive and effective prevention strategy. It's about integrating lifestyle modifications, pharmacological treatments, and precision medicine.
That's a lot of valuable information. It's clear that while there are challenges, there's also a lot of hope and progress in the field of Alzheimer's prevention.
Absolutely. By staying informed and proactive, we can all take steps to reduce our risk and support ongoing research efforts. Now let's shift gears and explore where the research on Alzheimer's disease treatment is currently heading. And for this part of the episode, we're especially lucky to have a special guest with us today, Dr. Mona Sayed-Gao, a renowned cognitive neuroscientist and sleep researcher whose groundbreaking work is advancing our understanding of memory and aging.
Dr. Saad Gao is a lead researcher at the Sleep Research Institution at Monash University, where her work focuses on the relationship between sleep and memory in older adults. She recently led an innovative study exploring the potential of pink noise acoustic stimulation as a tool for improving memory and cognitive health in aging populations. Her work has received widespread attention for its practical applications and implications for Alzheimer's research.
That's right. Dr. Sadek Gao's study examined how pink noise, sound engineered to synchronize with the brain's slow oscillations during sleep, could enhance slow wave sleep in adults aged 60 to 80. Slow wave sleep, sometimes called deep sleep, plays a crucial role in strengthening episodic memory, which is one of the first cognitive areas to decline in both normal aging and Alzheimer's disease.
In the study, Dr. Saad Gao and her team recruited 500 participants, split evenly between a treatment group that received pink noise stimulation and a control group that didn't. Using a wearable EEG headband, which is a not so fashionable headband that records how you sleep, the treatment group experienced pink noise bursts synchronized with their brainwave activity during the slow wave sleep over a 2 week period.
The results were amazing. Participants in the pink noise group showed a significant increase in slow wave sleep duration and improved memory performance on a widely used test of episodic memory, the Ray Auditory Verbal Learning Test. What makes this research so exciting is not just the promising results, but also the practicality of the intervention. Pink noise stimulation is really easy to use at home and is non invasive. It offers a glimpse into how sleep science might revolutionize memory care and Alzheimer's prevention strategies.
With Alzheimer's disease posing an ever growing global health challenge and limited treatment options that are currently available, Dr. Saad Gao's work provides a hopeful step forward. We're so excited to learn about her findings, their implications, and where this research might take us in the future. So, without further ado, Dr. Mona Saad Gao, welcome to the show. It's such an honor to have you with us today.
Thank you so much for having me. I am really excited to discuss this study and share how it contributes to our understanding of Alzheimer's disease and cognitive health in aging.
Let's start with an overview of your research. Could you tell us more about the study, its main goals, and what inspired you to pursue this topic?
Absolutely. Our study was motivated by the pressing need to address age-related cognitive decline, particularly episodic memory loss, which is one of the most significant challenges associated with Alzheimer's disease. We know that slow wave sleep is essential for memory consolidation, but as people age, this deep sleep stage diminishes significantly. Our goal was to test whether pink noise acoustic stimulation could enhance slow wave sleep and, in turn, improve memory. This works by administering targeted and brief sound bursts that are synchronized with brain activity. And to test this, we recruited 500 participants aged 60 to 80, all of whom were in generally good health. Half of the participants received pink noise stimulation during sleep using EEG headband, while the other half, the control group, wore the same headband but didn't receive any sound. Over 2 weeks, we monitored their slow wave sleep and memory performance using Ray auditory verbal learning test.
And what were the results? What did you discover?
The results were incredibly encouraging. Um, Participants in the pink noise group experienced nearly 50 minutes more slow wave sleep on average compared to the control group. That's a significant increase, like especially given how difficult it is to boost slow wave sleep in older adults. Even more exciting, their episodic memory improved. They recalled almost two additional words on the memory test compared to the control group, which is a meaningful improvement in this context.
That's fantastic. What do these findings mean for future Alzheimer's treatments?
These findings suggest that pink noise could be simple, non-invasive intervention to promote cognitive health in older adults. It's especially exciting because this method is practical for home use, making it accessible to a wide range of people. While this isn't cure for Alzheimer's, enhancing memory and slowing cognitive decline could significantly improve the quality of life for all individuals. However, we still have a lot to learn. Future studies need to examine the long-term effects of pink noise stimulation and its potential for individuals with mild cognitive impairment and early stage Alzheimer's. There's also a need to explore how this intervention could complement other treatments like medications or lifestyle changes to create a more comprehensive approach to care.
Thank you, Doctor. Your work provides so much hope for the future of Alzheimer's research and treatment. It has been an absolute pleasure having you here.
Thank you so much. I appreciate the opportunity to share this research, and I hope it inspires more conversation about innovative approaches to Alzheimer's care.
Great. We'll take a quick break now, but when we return, we'll discuss how caregivers and families can support their loved ones living with Alzheimer's. Stay tuned.